is when they talk about using some of the smaller accessories, for instance, for doing a shoulder, is they have it clipped here and hanging on the shoulder. But we've discovered an easier way. It's going to be easier for you and easier for the patient. If you leverage the back of the chair, have the tails come off the back, then you're going to put the area of issue in between two fields, hands-free. Instead of, if somebody's injured, having all of that weight on it. And this way, also, your patient, you can tell them to move the top one and find where they get their hot spot. Your hot spot being is where you feel the pulse most intensely. That's where you have the most problem, inflammation, degeneration. And you'll notice that if you move it closer to these nerves in the neck, it'll really fire all those nerves that are coming from your cervical vertebrae all the way down to your hand.
Now, I always have a hard time knowing which side goes where. Like,
the perforated side is pulling.
And what about the back?
So it's coming from the solid side to the perforated side.
Okay.
You know what I'm saying?
So on the back, you want to have the zipper side to you, and then the zipper side in front.
Right, so that you're pulling the magnetic field from the chair and the paddles forward. If you wanted to just use the paddles and you wanted to go backwards, you'd flip them over and you'd feel it completely different. You feel it more in the front rather than the back.
But you have to flip both sides, both the front and the back.
And you'd have to have no second accessory behind you.
So the paddles always have to be facing in the same direction.
That is correct. And we hope that they
His question's important, because if you have the chair running, you've got to have it this way.
It has to be this direction.
So if you're going to use two accessories, you have accessory number one, which is the chair, because it always stays in this position. We never flip it around. Accessory number two always has to have the flat side, the unperforated side, facing the first accessory so they can work together and pull through. If you had it flipped, it would be like taking two north heads of a magnet and they would repel each other. So you'll feel the difference. Go ahead and try it.
And if we can, we used to ask them to do it at the same time as the go-to meeting is going on, so that they can try it out themselves and understand what we're talking about as we're doing it.
Now, isn't the seat a different polarity, or when you go down to the seat, you
Yes.
have to flip it?
So Monica, you want to stand up? So yes, this is an exception, just like there are in languages, there's an exception. So there are 5 accessories. If you don't happen to own all of the accessories, let's say you don't have the square pad and you wanted to do something for the pelvic floor issue because they had bladder urgency, incontinence, low flow, just delivered a baby, maybe even erectile dysfunction, for instance. You can use the paddles, but you would think which side would have to face this first accessory, the smooth side. That's what I just taught you, right? But there's 2 hemispheres to this chair. There's the north hemisphere and the southern hemisphere. And just like on the earth, they're going in different directions. Have you ever heard that how when you flush a toilet in Australia, it goes in a different direction than when you do it in the northern hemisphere? So down here, the perforated side, the zipper side of these paddles, need to work with the way that this has been oriented, the way they have wound the wires. This is how they're going to work together. So I say, start in the right position with the smooth side here, and you're just going to flip like that. Make sense?
You can also do low back by just doing one, and then have the patient sit on this, and adjust this one to where the low back issue is.
And so almost everybody has the rings and the paddle. You might be asking, well, they're both nice and small, and you just use the paddles on Monica's shoulders. What are the rings for? The rings are constructed very differently from the paddles. So Monica, you wanted to show them how the paddles are constructed?
Yeah, so they come out in a spiral all throughout, evenly, throughout the entire accessory. That works completely different because it's 9 revolutions of copper coil, one on top of the other.
So this is very broadly delivered. There's only about 2.5 revolutions of cable, so you can imagine it broadcasts into the body very differently. Here, very concentrated, and this concentration is good for getting into joints. So especially like in a shoulder joint. Now, sometimes people think this feels better. Is one better than the other? It's what it feels, exactly. If you feel that that gets to the issue better, then you're going to want to do the therapy, and that's your body talking to you and you listen. Same thing goes for setting the pulse rate and setting the strength. Everybody wants to know, what pulse rate do I use for a shoulder? What intensity? what we have discovered is that it's not so much the pulse rate and an intensity that you need to meet in a certain number. It needs to be comfortable to the person. Otherwise, you're disturbing them, you're aggravating it. They want to feel it just enough, and it's the consistency of doing PEMF that makes it work, not setting numbers, not really.
And when it comes to the difference between the rings and the paddles, just like when you go exercise, you don't always do the exact same workout every single time because your body gets used to it. You want to switch it up. Same thing. You can try one session doing it with the rings, the next session trying it with the paddles. The paddles is going to grab a larger area. You can also work out those muscles around the shoulder that you're trying to work on. This is going to be a lot more specific, more focused, more deeper into the issue than the paddles will. So you want to try switching it around so that you keep that area rehabbing constantly.
It's more challenging to get a wave to go deep into fat and into bone. So more concentration you get from these smaller accessories, and especially this with 9 revolutions of cable in each. So leveraging over the chair, very smart idea. Want to go back down, we'll talk about tracing the pathway. So oh no, but you can show that. You can show the taco?
Yeah.
Okay.
So the square pad is great for isolating different areas of the back. You can use this for going for the upper back or the lower back, depending on what you're trying to work on. This is great for doing what she was saying, tracing the pathway, working on the area where the issue might be originating from, and then also targeting where the issue is manifesting so that you can target both spots simultaneously.
So if you wanted to, after you turn on the whole body, and that's what these bigger accessories are for, turning on the whole body, we say charge the core by putting your core in between 2 fields. So this is an exception to the rule. Sorry, this is not a smooth side. It's the black side, and the seam side goes out in order to work with the chair. So when you look at the chair, you want to match the way this looks in the front. Make sense? Now, to be honest with you, this overwhelms me. I don't prefer this. For petite people, you can also do what we call the figure 8, like this. So we're getting the lungs, the heart, the kidneys, the spleen, the liver, and we're engaging the lymphatic stations, the lymph nodes up here, the lymph nodes in the thoracic, and if you're lucky, down here.
How come those paddles are that way and the pad was the other way? Shouldn't the paddles be going out?
That's what she was saying. This is an exception to the rule, simply because this is a separate seat therapy pad. It's not an accessory that goes alongside the bigger therapy pad. It's made differently, just the way that the lighting is put together.
So you can, these are just tools, and we've learned more from doctors who are very creative with these tools as much as they've learned from us. And the taco came from a doctor. I don't know who it was, but for anything that's happening below the waist, if it's a knee problem, if it's peripheral neuropathy, it can be originating where? If the doctor's in the room, ask him, and he'll say it, coming from the lower lumbar spine, right? So we can isolate, we can turn off the chair, and we can isolate to a smaller accessory. Now, I could leave the chair on, but I'd rather target more energy, 100% of it, into something smaller, since I've already turned on the full body, right?
If you have the chair on, Marcia, and you use that, would not mess the polarity up in the bottom half of the taco?
You know what? It's so powerful. Technically, you're right. It's so powerful you won't notice a difference. You won't skip a beat. So the idea is to sit on this so your sitting bones are on the bottom half, and the top half is going into the lumbosacral area. So they can just sit right on it like that. Now, is it intense? You bet. It sure can be, especially if they have sciatic nerve issues, if they have the piriformis muscle, which goes around and very near the sciatic nerve. This will get that too. Also for upper shoulders, Monica, you want to lift it up? You can isolate up there. So again, have the chair off, put 100% here. If you get it so the area that you want to treat is kind of in the center, they'll feel it very profoundly into the upper trapezius muscles, the suboccipital muscles here. It's powerful. If they feel, ooh, something in my shoulder too, well, in that way we say it's, I don't know if we can still say this, diagnostic. It's telling you that wave is bumping into inflammation that you didn't even know was there. It's an old car accident, or, you played football in college. So we can add the paddles or the rings. Under top back of the chair. Yeah. You can add this, so you've got a lot of concentrated energy. Now, sometimes I tell them, let the patient have it with it doubled up in front, see if that gets to their issue. If not, then go ahead and split them. The center is going to be the strongest in both of them. You can do this with the rings, or you can do it with the paddles. If they had a digestive issue, doesn't it make sense? Here's the perfect accessory. You can double it up like this. Or do they feel it more when having one in the back and it's pulling through the entire area? Any women in the office who have their friend call once a month who have issues? You need to be doing this all during the month, not just isolating it when their friends come. Yes, they come and stay for a week or so, Dawn.
I'll say it, they're monthly cycles.
Thank you. They're men's. Now, let's show them, as long as we're here, the new position for the brain. So we advocate that this system is a system. Turn on the whole body, go to areas of pain, and do the brain. And that's a session, because the body works holistically. The brain is powering everything, it's telling the body what to do, it's innervating every organ, every muscle. Now, we used to hang them on like you were an astronaut, and they would put on like a baby bonnet, but Dr. Gilman showed us this in Florida. Let me take my glasses off. And Monica, I don't know if you do, but I sometimes put Velcro around there. Yeah, she's just holding it. And this is much more comfortable. If you have the paddles further down on the face, it can sometimes engage the eye muscles, and people don't like that. However, if people have issues with their eyes, this is a good way to deliver some energy there. So you can adjust this, and you can do it the other way like this. Dr. Augustine likes to do the rings on the head. He thinks it's very concentrated and it stays up here. If people feel it in their teeth, that's because the magnetic field is engaging with some old metal fillings in there, and it will charge up around there, and they'll feel it more. If they don't have metal and they feel something, what's that an indication of? Perhaps something that needs to be looked at. And we also have up on Close Certified a tooth chart, because the meridians from teeth and nerves also are connected to organs. So if you can identify an issue in a tooth, you might want to look into charging the organ that it's attached to. Okay, let's do a tracing the pathway for something like carpal tunnel syndrome, okay, which is painful down here. It's a very fibrous tunnel, and nerves get inflamed.
Usually we put like a little blanket or something.
Yeah, it's good to have blankets or pillows so you can make people more comfortable if they're going to sit here. So for this tiny area, I would use something concentrated like the rings, put it in between, and then we're going to put a paddle up here. Why? Because lots of times the issue can be coming from up here. It can be coming from the neck, from the cervicals. Those nerves travel down into the shoulder. There can be entrapments and impingements all the way down the arm. Sometimes a good massage therapist will find trigger points in the arm, in the forearm, that are actually responsible for carpal tunnel. So what we say is look where the issue is and work backwards, or make sure that you get that, the traveling of the pathway. So like I said, anything happening below the waist, we do the lumbar spine. Monica, let's go ahead and do a knee setup.
So now, if someone had the equine loops, they would just use it in the exact same manner, the medium and the small equine loops.
Yes, putting the issue between the two of them, yes. So it's good to have a little stool in the office. So some people get swallowed up in the chair and it's harder to get at the knee, so it's good to have that. And I've even taken the square pad and put it back here just to bring them up a little closer. So putting the knee in between, this is a fantastic and effective knee treatment. Whether it's a torn meniscus or they've got arthritis, whatever it is.
For the knee, it's better to put the Velcro through both rings so that it touches right here. Because like what we were saying about the meeting part of the loops, it's going to be double the amount. So it's going to go really deep into the knee. They're really going to feel
Yes, this is one position to do, and another position to do would be to loosen it up
and let it drop on the sides.
and let it drop on the sides, right?
Another one was actually long enough.
So in engineering, they can create a uniform magnetic field by having them exactly in parallel like this. So you would just loop them so that it was comfortable.
Right here.
Right. So however they feel it the best, they like it TP'd, that's one way. Here's another way.
You can also lay them down and put underneath and on top.
I think whenever you're treating a knee has an issue, that you mix it up during their series of sessions. You go east and west one time, you go north and south the other. Another thing to do, especially if somebody's had an injury or it's after surgery and they're rehabbing, is you want to strengthen this muscle that holds the knee too. And actually with the paddles are better. And you should have received a very thick piece of Velcro with your system, and you don't have to do it up, Monica, but you can show it to them. And get this, and get a nice big pulse so that you're getting a muscle contraction, right, Tim? Right in that knee, right above. You're bringing a lot of circulation to the area. You're challenging that muscle. The muscle that holds the knee, it's very important. And it's also why the knee, you want to get the lower lumbar spine, because if those nerves are not sending signals to the knee and the muscles around the knee, that knee gets sloppy and you don't even know it. And all of a sudden you've got arthritis. So this is as preventative as it is reparative, really. And that's a slow education for your patients as you begin to tell them more about what PEMF can do for yourselves. I've found studies that say that this can have protective benefits for the cartilage of your knee. So whether you're athletic and very active or you're not, why on earth would you not be taking care of your knee and your hips? How many people do you know who are having knee and hip replacements? A lot. Peripheral neuropathy, we get a lot. Now, we don't have protocols, but we're going to show you what works really great for peripheral neuropathy. Is, of course, we want to do the lower lumbar spine after we've done the whole body. Get the leg up. Now, there are a lot of deep nerves that go through your calf that feed to those tiny peripheral nerves into your feet. So we create a tremendous amount of energy and circulation, and then of course the boot would not be on. And you can really turn it up, because when you're not up here on the core where you get a lot of muscle contraction, you can really turn it up down here. A lot of bones and ligaments and tendons. So you can run two accessories at once.
Isn't it like 5.5 to like max strength?
5 pulses at 100. Yeah, 103.
Again, I'm going to tell you, it's the consistency of the sessions more than it is that, but 5.5, because you're right, we've got bone, and that's the strongest.
You've got dead nerves so in the feet too, so you got to wake those up again.
I hope you understood from Pulse Certified that the strongest the machine can be on the Pro is at 5 pulses per second, cranked your magnetic field strength all the way up, and in these accessories, the accessory of the rings with 18 revolutions of cable, that's the strongest accessory at the strongest pulse rate at the strongest magnetic field strength. You don't have to be at the strongest to get results. We know that. But you can be. And especially on bone and ligaments and tendons, you sure can go there.
That's where it feels strongest, or that's where it actually is strongest?
It actually is the strongest.
Especially with the rings. That is literally when it's at its strongest.
At 5 pulses. So if you're looking on the window of your Pro right now and you've got it at, let's say, 5 pulses per second, and you've got it at 80%, it's saying, in the magnetic field strength, if I go to 6 pulses per second, it's 10% less than 80. It says 80, but it's really 72. And then when I go from 6 to 7, it's another 10%. And the reason we do that is so you can work up in those higher pulse rates. Because a lot of doctors do like to do that. The brain is supposed to be entrained to about, the sensory motor rhythm rate, they refer to it. It's 10 pulses per second. There's actually PEMF for depression called the NeuroStar, and that's what they do. Put it in a specific place on the brain, 10 pulses per second. Of course, there are many, many different frequencies in the body. And on a molecular level, on a tissue level, on an organ level, they're all different. But your body will take what it needs. And if you're doing somebody and they say, oh, 7.8 pulses, I don't like that. It's too fast. Their body's telling them they don't need that right now. We've got 19 other choices. We're going to find what feels right to them. But I found that 2 pulses per second is what I introduce. Then I immediately introduce them to 7.8 and ask which they feel is better for them right now. And lots of times people will say 7.8. I think it just evens it out. It's nice and smooth. So it's good to have wipes, alcohol wipes, because after you've done somebody's foot, they might go, oh, you know, the next person comes in and goes, I've got TMJ. I need to work up here on my face. So this is fantastic for anything on the face. People have sinus issues. Don't hesitate to put the paddles on or hold those anywhere there's an issue. Down to a finger in between 2 of the rings.
Or holding the rings.
What about the neck? We seem to have a hard time reaching people that have pain in the neck.
It's true. By leveling one on top of the other like that, you're going to be able to get a little bit more of a curvature that is going to go along with the neck.
Okay.
And it's also going to be working on a little bit lower on the spine as well as a little bit higher. So you're going to get energy both in the brain and on the spine. But that's going to be the best way to kind of curve along the neck.
Okay.
And I'll tell you, everybody's different. You look at people and they all have a curve in their neck, right? And some people have only, 6% of a curve. So you're going to have to adjust this for what makes them comfortable, And I also, when people have neck issues, I like to get them on the bed and have them laying down because then you have gravity working with you. And you'll make a lot more contact on the bed.
I found that in the chair, trying to get to the neck, using the square pad, because the pad is more malleable. Well, it's just been my experience.
Have you ever tried lying down and using a square pad or this?
Yeah.
Yeah. See, this is the challenge. And Paul even built rings. We don't have them here. Have you ever seen them, Marcia? Rings, Wendy knows about them. And it looks like somebody took our rings and destroyed them.
Just squished them and
They
bent
were
them in.
squished, and they tried to make it, so that it would cut like this. And then they put, but not on everybody.
And it's everyone's neck is a different size.
Exactly. Paul said if they want to have some custom made, he would make them for them because we get this comment a lot that it's very hard to get at the neck.
You know what I've been using? So I'm going to put it on your shoulder. Okay. Using the paddles, slide the one that's in the back a little bit further, and then when you Velcro it towards the front, and that's going to hit a little bit more on the top like that. They seem to feel it a little bit more when it's right up here that the pain is,
In their
rather
neck?
than the back. Yeah. When it's right down here on their shoulder more than the neck.
You're saying Velcro down.
Just Velcro up here so that it pushes it a little bit forward, right? So it's going to curve more with the upper part of the shoulder rather than back in the shoulder blade.
Now, someone told me that you can actually roll those paddles. Is that correct or no?
Yeah.
You're
going to deform it eventually.
That's what I thought.
But yeah, that's going
And
to
it distorts
deform
the
them.
field.
Exactly.
And you can also mess the wire up.
Yeah.
Right.
Okay, that was,
Cracking in
The
the wire.
DF pad, the way that it's constructed, it's a little bit easier to bend it without having any issues, but the paddles the wire's too close together.
okay.
And you have to remind people, the reason that you have a problem in your neck, is it in the muscles here because you've been in front of a computer and you're driving a car and you're on your phone? Is it really a muscle issue, or is it really in the cervicals because you have degeneration up there or you have a bulging disc? If they know the difference, or the doctor knows, and he says it's a bulging disc, you can get right to it with this. And yeah, it's not the most comfortable thing in the world, but I've worked on lots of people. They're like, oh,
Yeah, and really, when
there it
they're in
is,
so much
right
pain,
there. And you give
that's a
them
little
control.
discomfort.
You give them control to angle this right into where their bulging disc is. And they can get some relief.
The other position that we always talk about is pelvic floor on the seat pad, just because everybody thinks that that's a footstool and it's not.
Right.
So that's one of the last things that we always tend to show.
One reason why Gary renamed that the seat.
Right.
And the square pad with the seat, not square pad with footstool.
So you have 2 ways of using it. Sitting on where it's going upward because it's going to curve with your body, and then you lean forward and slowly start straightening up until they feel that hot spot. The other way to use it is like this. So it depends on who you're working with.
Okay,
This is more for women, right?
Yeah.
okay.
And
And
then
then,
if we're added, you can add the paddles or the rings in front.
and what is the, For sciatica, what was the recommended
So,
setting?
Dr. Lee,
Mhm.
oh, the seat?
Well, wasn't there a certain, like, at 38% and that had been found to work?
Now, here's a whole nother subject, is, and I ask doctors when I'm on the phone with them when they first get this, is do you muscle test? And some of them do and some of them don't. And I think this is an issue, and I think it's something that we want to look into, hopefully getting somebody to do just a rudimentary training of how to muscle test for what organ. Is it 1 to 5 pulses per second or 6 to 10? Is it at this rate or this rate? And he gets tremendous results. And he said, in general, I said, if you had to make a generalization, what can you tell us? He said, on the core, a lot of people test for 7.8 pulses per second and 38%.
And that's for
magnetic field
sciatica.
strength. But I can tell you plenty of other doctors are going to tell you something different.
Okay.
And that's why I do believe, and Dr. Pollack writes about too, that it's the consistency of the sessions that gets the result.
Okay.
We aren't a medical device, let's be clear. So they'll say, well, I was on PubMed and I read about, fibromyalgia and they did it at this pulse rate and this frequency. Well, that was a medical device treating fibromyalgia. We are general PEMF exercise. We believe if you turn on the whole system and the entire body and all of its systems are charged, that the body will come into balance.
Setting it where it's comfortable for the
Where
person.
it's comfortable,
So-
exactly, and doing it consistently. This isn't medicine, this is exercise. If you've ever engaged in an exercise program, you have to do it with consistency to get results.
So a couple of other positions that I was thinking about for sciatica, Dr. Lee showed us at his office to use the bed, the direct focus pad on the side that is bothering them, and then with the rings on that same knee.
Really?
So you like that.
Yeah, he's gotten results this way.
Okay.
So again, these are tools. If you come up with a creative idea, try it. Putting an area of issue between two fields. She's tracing the pathway at the same time. And Dr. Lee also said during the lunch and learn, somebody asked about a stroke, right? And he said, sometimes I put them on the bed on that side for their whole session, the side that they had the stroke on. And then he also does the head.
Okay. Same thing with Parkinson's. You treat the head correctly?
Of course, you would treat, he says turn on the brain, right? That's the master control center.
Warm up
For
the body and
everything,
treat the head.
right? Turn
And
on
then
all
go to
the
the focal
major,
area.
all the major organs,
Yeah.
and then focus.
I was going to say that when you were talking about it, what I've experienced, a lot of the docs that I've worked with, we used to say head first and then body. But we got a lot of Herxheimer's. But if we turned on the lymphatic first at body and then the head, those headaches and some of the Herxheimer went away, especially with headaches. They would complain with headaches if we did the head first and not the body.
Okay.
The body wasn't ready to drain what was up here.
That could be because
that
it
could-
was the first time, too.
Right,
Right.
yeah, for the first time.
So one of the most important parts of your job is to manage the expectations of the people who are going to have the session. We'd love for this to be a fantastic experience. If you're in pain, we'd love for you to be, significantly in less pain. We'd like for you to sleep better. We'd like for you to feel better. However, the body's complicated. You're unique. Your general health, how you eat, so many things contribute to how you got to this point and how you're going to respond to this, but we're going to fine-tune it. So in this first session, if you feel worse than you did before you had it, or even nauseated or in more pain, that's part of it, because we're giving the cells enough energy to start to clean house. They're releasing toxins. Hopefully we engage the lymphatic system enough so that we can release those toxins, but this is just a phase that you might have to go through. And many of you might have a fantastic experience. And if you got no result at all, that just shows we have a lot of work to do. Does it work on everything 100% of the time? We can't say that. But PEMF is always working.
So there's some positive benefit. You may just not be feeling it immediately.
Correct. It might take a long time to manifest, and your improvement might be 10% only, and hers 50%, and his 60%.
And the time that it lasts, the benefits is totally different too. It just just depends on how much you use your body and how you're using it and what you're putting in it too. If you're not hydrating enough, well, obviously the results are not going to last that long.
Or we tend to say the longer it's been a chronic issue, the more treatments in the beginning it's going to take to make it last.
I think that's a fair statement.
Yeah, that is a fair statement. And people understand that. It's that way in everything.
Yeah.
I'll say one thing. People ask, can children do this? Can old people do this? I've worked on a woman as old as 98 for her back, and she liked it very much. And I worked on a 2-year-old who had spina bifida, did not have use of his legs, and his energy was great from it. So the practitioner has to be the doctor. Look at the size of the person that you're going to treat and use your common sense. Say
Yeah.
it is older people. Mark, you've had this experience.
Yeah.
I don't feel anything.
Yeah.
And they got to turn it up, and they crank it up all the way. 5 pulses per second, 100%. I don't feel anything. Well, why is that? As we get older, the cells, of course, are not going to respond. They're not even reproducing and regenerating in the same way they are when we're younger. So here's the pros and cons of turning it up. Yes, they want to feel something. Some people will have a benefit from it, but if they're arthritic, you could really aggravate an arthritic knee. I'll tell you, I've done it, and you feel terrible. But you cannot be afraid. You will learn as you do this. Do it on each other, do it on yourself, and that's how you're going to learn.
It's the main thing that we repeat over and over again. Use it on yourself. Get your own story. You don't have to know exactly how to explain the whole science behind it when you have your own story to tell. I don't know how it works, but it helped with my shoulder. You should try it. You know what I mean?
Now,
They trust you. They trust everybody in this office. That's why they're here, because you share your stories. Don't tell them about the science. Most people don't want to know.
It's going to go over their head anyway.
They want to know, did it work for you? The doctor wants me to try this. What do you think?
yeah.
You've got to have a story. And if it's not your story, it's your mom's story, or your boyfriend's story,
Or the doctor's
or what
story.
you've read, or the doctor's story.
You got to use it on yourself.
Now with elderly people though, so I just want to ask about this because our caveat has always been low and slow with elderly people and give them an expectation that it's going to take a few treatments to get result. Do you guys agree with that?
It
Or-
depends. I mean, if we're working on like peripheral neuropathy, obviously not.
Yes,
so
that's
you want to go
yeah.
a little bit harder. But if you're working on full body or you're working on an injury, yeah, low and slow is better.
Okay.
I
And
can't
the
judge.
injury is the key. If it's acute injury, low and slow.
Well, of course, and hopefully they got that from Pulse Certified.
You
Everybody
pretty
knows
much just
that,
have to
right?
get to a point where you see that area jolting enough and then back away from it a little bit. It doesn't have to be jumping out of the chair. Just that it's deep enough where it's getting some good stuff.
Okay.
They might not feel it. That's